Hello everyone, welcome back to this channel. Today we will discuss about what blood pressure really is and how to maintain a good blood pressure. The vital force understanding blood pressure. Blood pressure is the force of blood pushing against your artery walls. Imagine water moving through a hose. The stronger the pump, the higher the pressure inside the hose. Similarly, as your heart pumps blood, it creates pressure on your arteries. This pressure is essential for life as it delivers oxygen and nutrients throughout your body. We need a certain level of blood pressure for our organs to function properly. However, if this pressure becomes too high and remains elevated, it can damage your arteries and lead to serious health problems. This is why understanding blood pressure and keeping it in a healthy range is crucial. Think of your arteries as a network of highways transporting vital supplies to your body's cities and towns. High blood pressure is like traffic congestion on these highways, making it difficult for supplies to reach their destinations efficiently. Measuring the pressure, systolic and diastolic explained. Measuring blood pressure is a simple, painless process. A healthcare provider uses a device called a sphygmomanometer, commonly known as a blood pressure cuff. The cuff is wrapped around your upper arm and inflated to temporarily stop blood flow in your artery. As the cuff deflates, the healthcare provider listens with a stethoscope for the sound of blood flow returning to the artery. This first sound represents the systolic pressure, the pressure when your heart beats and pumps blood out. The second sound, when the sound fades away, indicates the diastolic pressure, the pressure when your heart is at rest, between beats. However, now with the advent of digital machines, it has become much easier and straightforward to measure and keep record of blood pressure. Be mindful to use only a well-calibrated digital machines. Blood pressure readings are written as two numbers, with the systolic pressure on top and the diastolic pressure on the bottom. For example, a reading of 120 over 80 millimeters of mercury means a systolic pressure of 120 and a diastolic pressure of 80. Decoding the numbers. What is a healthy range? Understanding what your blood pressure numbers mean is crucial for managing your health. A normal blood pressure reading is typically below 140 over 90 millimeters of mercury in the clinic, or below an average reading of 135 over 85 if measured at home or ambulatory measurement. High blood pressure, also known as hypertension, is diagnosed when readings consistently reach 140 over 90 or higher in the clinic, or if measured at home or ambulatory, an average reading of above 135 over 85. There are different stages of blood pressure based on numbers. Extremely high blood pressure readings of 180 over 110 or higher is a medical emergency known as a hypertensive urgency or emergency, depending on symptoms and target organ damage. This condition requires immediate medical attention as it can lead to severe complications like stroke or heart attack. Section 4. The silent threat risks of high blood pressure. High blood pressure is often called the silent killer because it typically doesn't cause noticeable symptoms. You might feel perfectly fine, but behind the scenes, high blood pressure can be silently damaging your arteries and increasing your risk of serious health problems. Over time, uncontrolled high blood pressure can weaken your arteries, making them more susceptible to hardening and narrowing. This damage increases the risk of heart attack, stroke, heart failure, vision loss, kidney disease, and even sexual dysfunction. The longer high blood pressure goes unmanaged, the greater the potential for damage. That's why early detection and management are crucial for preventing these complications and living a longer, healthier life. Section 5. Lifestyle as medicine, lowering your blood pressure naturally. The good news is that you can take significant steps to lower your blood pressure and reduce your risk of complications. While medication is sometimes necessary, lifestyle modifications play a powerful role in managing blood pressure naturally. One of the most impactful changes you can make is adopting a heart-healthy diet. Focus on consuming plenty of fruits, vegetables, whole grains, lean proteins, and low-fat dairy products. Limit saturated and trans fats, cholesterol, sodium or salt intake, and added sugars. The DASH, or dietary approaches to stop hypertension. Diet is an effective plan to lower blood pressure. Regular physical activity is another cornerstone of blood pressure management. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could include brisk walking, jogging, swimming, cycling, or dancing. Section 6. Heart health for life, regular checks and healthy habits. Maintaining healthy blood pressure is an ongoing journey, not a destination. By embracing a proactive approach to your heart health, you can significantly reduce your risk of complications and enjoy a longer, healthier life. Regular blood pressure checks are essential even if you feel healthy. In fact, if you can keep a record of your blood pressure over a period of days to weeks, while at home, and show your readings to your healthcare professionals, they will be able to understand better about your blood pressure rather than judging your blood pressure on one-off reading in the clinic. This especially applies if you are worried about your blood pressure, because blood pressure readings can fluctuate based on different factors like time of the day, stress and anxiety levels, etc. It's a standard practice to keep a record of several days' readings and take an average of all. Early detection of high blood pressure allows for timely intervention and management, preventing potential damage. Incorporate heart-healthy habits into your daily routine, including a balanced diet, regular exercise, stress management techniques, and adequate sleep. Remember, small changes can make a big difference when it comes to your heart health. By taking care of your blood pressure, you're investing in a healthier, brighter future. Thank you for watching and keeping your blood pressure under control.